So in fact, it's a disease that it's very difficult to transmit actually. So to get infected, you have to be in direct, close contact with someone that is either severely sick or with dead bodies. So yes, you can get the disease from hugging a dead body, but that's something that in our cultures we are unlikely to do. So in fact, the people that are not severely sick are basically not infectious. Even the infected people that have not yet developed signs and symptoms, they cannot transmit the disease. We cannot detect the virus in the blood until the person develops the symptoms, until there is fever, and the patients become really infectious at the very last stages of the disease, when there is a lot of virus at the end, with the vomiting in the blood, if there is bleedings, in the diarrhea and so on. But in the general normal situation, we are unlikely to get in touch with the fluids of very sick people. If we are sitting next to the plane to someone that is traveling from West Africa, you are at a very little risk.
Can we see? Yeah, you can go there, but the body is there already. For now, I can tell you.
So maybe you have seen the pictures of our recovered patients. So we hug them when they are leaving to try to reduce the stigma in the community, because often the recovered patients, they are still stigmatized as having the disease. But in fact, they are no longer infectious once they are no longer sick. So it's a bit the same as at the beginning. Once they recover from the disease, we cannot detect the virus in the blood anymore. The drugs, the ZMapp that has been used on the 2 Americans, it's as well in the early development stage, in the very little quantities available. But in MSF we are looking with excitement, waiting the possibility that we can use the drugs for the patients. But then this is, it has to be done in the frame of international institutional bodies like WHO, the government. The main difficulty we have today is to find the number of people that have been trained, that are able to set up new treatment centers in the affected countries.